Well, childbirth is an amazing experience. Most parents in Canada go to their local hospital to give birth, but increasingly there are parents who decide that a home birth with a midwife is the way to go. So joining me here in studio to discuss this is Terrie Shaw. She is a registered midwife and a registered nurse, also the founder of Wild Sage Midwives in Lethbridge. Here she is now. Terrie, great to have you with me today. Thanks so much for joining me.
Thanks. It's good to be with you. I'm so sorry. I just need to correct you. I did work as a registered midwife, a registered nurse for years, but now I'm just focused on midwifery now.
Yeah,
so.
No, I don't blame you, because talking off camera, it sounds absolutely fascinating. Okay, so first of all, maybe briefly explain to us what midwifery is.
So midwives are like birth specialists. You can see, we're considered primary care providers. So you would see just a midwife through your whole pregnancy for anything pregnancy related. We can order all your labs and ultrasounds and then of course all your prenatal visits and the postpartum visits. We catch your babies and stitch you up if we need to, that kind of thing. Anything not pregnancy related, you would need to go to your family doctor, but anything pregnancy related, we see you through all of that. It is considered a 4-year degree program, so you do go to get your bachelor's for that. Right now there's about 186 registered midwives in Alberta.
That's it?
And yeah, we need more for sure.
I was going to say, you must be really sought after.
Yeah, midwifery is in high demand, no question.
Okay, interesting. Yeah. So it used to be that if you wanted a midwife, you have to pay for it out of your own pocket. But that's changed now, right, here in Alberta? So it's covered by Alberta Health Services?
It is covered by Alberta Health Services, yeah. And you're right, it did used to be that people paid out of their pocket. And that changed, I think, in 2009 when it started to be covered here by Alberta Health Services.
Yeah, it's a nice option to have.
Yeah, and it used to be that if you had a midwife, you had a home birth, but that's also changed. Midwives now have hospital privileges, and so we can deliver in hospital, out of hospital, and home births. And when I say out of hospital, sometimes that's a birth center, sometimes that's a hotel room.
Oh
sometimes,
my gosh.
Yeah.
A car, a taxi cab?
Yeah, sometimes.
Has that ever happened?
Yeah, it has, yeah.
Oh my gosh. Is the demand for midwives still high? Like, is there a lengthy wait time to get in, to get a spot with one?
There is. I'm already booking into August of next year.
Okay.
And full up until that point.
Okay.
I think most midwives get filled up pretty quickly.
Yeah.
Our clients tend to contact us, as soon as they see that line on their...
little line on the pregnancy tag, because I was going to say August, that's 9 months out. So literally they are holding the stick and calling you?
Absolutely. I get them, Terrie, I'm 3 weeks and 2 days pregnant. Oh. And of course, it's easy to, if they have a miscarriage or if they end up not being pregnant, it's easy to fill those gaps. But if they are pregnant, it's hard to open up any more gaps because we have a cap on how many we take.
Are you working with them throughout the whole pregnancy?
Yeah,
basically?
you
are. Okay.
Through the whole pregnancy, and then about up to 6 weeks postpartum, you follow them and their babies.
Oh, you must be so busy.
It is busy, yeah.
So let's talk about the advantages of having a midwife and giving birth at home or a birth center. So what are the advantages?
Well, I think one of the things that we really love about midwifery is the continuity of care first. You really get to know your clients, you get to know what their desires are. And they know who they're going to see every time, who's going to be through their pregnancy, who they'll be seeing, who they will be seeing at the birth, and then as well as the postpartum care. So I think the continuity of care is really important, and you just really get to develop that relationship with your clients. And then the other things I think that we love are the informed choice discussions. So we go over what the pros and cons, what the recommendations are, and then we help our clients to make a choice regarding different things applicable to labor and birth and pregnancy. And then we support them in their choices. We, don't bully them into doing things that we think they should do. Our job, as long as we have given them all the information they need to make an informed choice, then our job is just to support them in their choices after that. So I think that's another thing that we love. And then, of course, the postpartum care to me is really important. We try to see mommies in their homes for the first week after they've had a baby, so they don't have to pack up their baby and come in somewhere.
Good point.
We like to go and check in on them while they're at home and make sure that both mom and baby are doing well, that breastfeeding, if they are breastfeeding, is well established, that weight gain is appropriate, and that bonding is happening between mom and babe, and that there's no concerns. So
it sounds like they're very well cared for, and that would be a super advantage, and that they're not feeling rushed through things, because you were saying like they make informed decisions. No, that's great. So I know there are some people that have questions about using a midwife. So for instance, is it too risky to deliver at home without a doctor on hand? So what if there's an unforeseen emergency?
I love those questions. So everything that we have at our fingertips in a hospital room, we have at our fingertips at a home birth. Things that we can't bring are things like a C-section or an epidural. We can't bring that to a home birth, but we are very vigilant in monitoring. So we monitor really close, because nobody wants anyone to be going, oh, I hope everything's okay. I hope nothing goes wrong.
Right.
So that's why we monitor closely. And if those yellow flags or red flags start to show up, then we might go, you know what? It's better if we transfer in. If we can't resolve the issue right away, then we transfer in, so that we aren't stuck with an emergency at home.
Yeah, no, exactly.
And the research shows actually that home births are just as safe as hospital births when attended by a trained professional.
Okay. You mentioned that you can't do epidurals at a home birth. Why is that? Is it because you need the training to do that? You need it like an anesthesiologist?
Correct.
Okay.
Yes, we don't have that training. And something that should be monitored very closely, and that would be something that should be done in the hospital.
Yeah, no, that makes sense. I would imagine that you, over the years, have run into some crazy emergency situations, like a cord wrapped around a neck or a breech birth. How do you handle those?
Yeah, to me, those aren't crazy emergencies. Those to me are just more like variations. We know that sometimes a cord is wrapped around the neck, and
it just sounds so scary. To somebody who's not in that field.
For the most part, we just unloop the cord. It's pretty easy. Those surprise breaches, you go, okay, you talk to the client. Remember we had this conversation, and here we are, and depending on how close we are to birth is whether or not you're going to transfer in, or if you're going to stay home and call an ambulance, or if things go well, if the client chooses to just stay home and have a breech vaginal birth.
Do you have equipment with you? Do you have like ultrasound machines or like IVs for injections?
Yeah, so we don't have an ultrasound machine itself per se, but we do have Dopplers that we use to monitor baby's heart rate.
Great.
We have, all the things to monitor mom's blood pressure, heart rate, all that kind of equipment we do carry with us. So. We medications for, if they're having an anaphylactic reaction, medications if they're bleeding, anything to deal with postpartum hemorrhaging. Yes, we carry IVs and those those kind of things too. So
I know I had a horrible labor and delivery experience. It ended in a emergency C-section after 39 hours of labor, and I was not considered high risk whatsoever. So are there some pregnancies that are considered too high risk to be done by a midwife, and you would recommend them being in the hospital instead?
Oh yes, there are, and as those red flags come up while they're pregnant, then those ones we consult with an obstetrician, and then with consulting with the obstetricians will determine whether or not they're safe to stay and remain in midwifery care, or if they need to be transferred to the obstetrician, and then the midwife can stay in supportive role and still attend with the mommy and be there with her and her family to help her through that.
Yeah, I know you were mentioning before that sometimes it goes full circle. I mean, you've been doing this for 40 years.
Yeah.
So you've seen some of the babies you've delivered have grown up and have used you to deliver their babies.
To deliver
That's
their
wild.
babies, yeah. It's exciting, actually. It's wonderful.
I love that.
Yeah.
You know, some people might ask if they would have access to the same tests or prescriptions that they might have if they use a doctor.
Everything that a pregnant mommy has access to with an obstetrician or with a family doctor that does obstetrics, a mommy has access to all of those same things too, even with a midwife. Yeah. We might have to consult for some of those things, but they still have access to it.
I love how you call them mummies. Oh, yeah. That's your clients, the mommies. Yeah. I love that. So some moms, some mummies, I'll just use your terminology, decide to have a water birth in a pool of warm water. What's that all about? Can you explain why that's a thing?
Yeah, so probably a lot of women report to me, I've not had a water birth. It just wasn't a thing when I was having babies. Yeah. But the women that have water births tell me, oh my land, it is so much pain relief. You know, you can imagine you're achy, you're sore, you're hurting, and then you get into a nice warm bath and
well,
you can just relax. Bath, right? Exactly, you can relax. And the truth of the matter is that baby's swimming in water, living in water, and it's just transitioning from water into water. Okay. So there's water births are also known to be very safe.
Okay, interesting. Maybe get the jets going a little bit.
We have birthing pools, and what's really wonderful is right now, some of the hospitals, many hospitals offer water births for clients.
Really?
Tabor has water births for, the Tabor midwives have water births for their clients in Tabor. Okay. Pincher Creek has water births, and we're trying to follow suit here in Lethbridge at the Chinook Regional Hospital. They're just trying to finish the policy so that we can offer it here for women. So hopefully it'll be coming here soon too.
That's wild. If someone wants to choose a midwife for childbirth, how would they go about setting that up?
Yeah, there's a provincial client wait list that they can apply on. And that's a really good way to monitor how many people are looking for midwifery care, and so they can go on the provincial wait list. A lot of clients don't stop there. They like to connect directly with each midwifery practice to hopefully increase their chances of getting in. And of course, if you have repeat clients, they often just contact you directly and let you know, hey, I'm pregnant again. Do you have space for me? So
wow, that's wild. I love the personal relationship that you build with your clients.
Me too.
Your mummies.
That's right.
Terrie, thanks so much for being with us today. I really appreciate having you on and learning about this fascinating field of midwifery.
Thank you. It was lovely to be here.
Awesome. Terrie Shaw is a registered midwife and founder of Wild Sage Midwives in Lethbridge.